Namaste. So I'm back. In the first module, we introduced the concept of patient safety and discussed why we need to study it. So welcome to the second topic of this course, which is on why applying human factors is important for patient safety. Human factors examines the relationship between human beings and the systems with which they interact. The focus is on minimizing errors while enhancing efficiency and work satisfaction. The objective of this module is to understand human factors and how it relates to patient safety. Now, human factors and ergonomics are terms that are often used interchangeably. What they describe are the interactions between the human, the task at hand, and the workplace itself. Human factors apply to all situations where humans work. So, it is the study of the factors that make it easier for us to work in the right way. Sometimes it may be referred to as a study of interactions between humans, the tools, and the environment. Experts believe that studying these interactions can reduce errors and improve healthcare quality. Now, high risk and complex industries such as aviation, manufacturing plants, and the armed forces have been utilizing the study of human factors and the systems theory to create safer outcomes for several years. Investigations into major and minor events that occur in complex settings reveal the lacunae in the processes that led up to the undesirable outcomes. Think about it. Several decades ago, it was fairly common to assign pilot error as a cause of an air crash. However, with the human factors, engineering principles, and the systems approach, the aviation industry has recognized that it's not just the pilot, but the pilot operating a complicated machine while working under stress. So it's the combination of the person, the task, and the environment that is responsible for the air crashes. The healthcare industry has only recently begun to adopt practices from these other industries to enhance patient outcomes. Human factors engineering has revealed that it's usually not the number of tasks at hand, rather the nature of the tasks that affects the likelihood of errors. The more the work at hand, the more complicated the task at hand, the less successful one is at multitasking. Now think about the time when you were focused on performing a complex task. Maybe you were writing your final exams and had to simultaneously dictate the answers to your neighbor. But on the other hand, you may be easily able to dictate an elaborate answer if you were simply waiting to hand over your paper. So while performing the task of writing your paper, which required all of your attention, dictating an answer was difficult. Communication failures are also common reasons for some of the major adverse events. All of us in the healthcare professions need to have basic knowledge of human factors principles. Now, human factors experts help design environments in the workplace that work for all workers with varied skills and abilities. They take into account the limitations of the workforce and the environment and help all of us get work done easily and in the right way. This decreases the likelihood of errors. Good designs take into account the entire range of workers, not just the fast ones, but also the slow ones, not just the calm ones, but also the stressed ones, not just the experienced, but also the inexperienced ones. Human factors experts use evidence based methods to improve safety while prescribing and dispensing medications, while performing handoffs, moving patients from one place to another, electronic prescription practice, and specialized medication preparations. With their interventions, all of these tasks become easier and safer. You may have come across medication names that sound awfully similar. A very typical example from my own branch psychiatry is the drug haloperidol. It's an antipsychotic, and a commonly available brand name is Trancodol. However, pharmacies sometimes mistakenly dispense Tramadol, which is the brand name for an opioid analgesic, when they receive prescriptions for Trancodol. So, such avoidable confusions are everywhere and are frequent sources of adverse events. Think about all the technology we have around us in the hospitals and labs. The complicated machines and tools, if used incorrectly, can lead to disastrous consequences. Human Factors aims at simplifying technology to achieve the desired goals. So the slide tells you we can conclusively state that healthcare today is very complex. Just look at the OT environment in which all the team is working. To err is human. So human factors engineering accepts this human fallibility and recognizes that errors will occur. And so the resources are focused on minimizing the chances of errors through workplace and instrument designing strategies to suit the workforce. The human machine interface is an important part of this design. For example, the intensivist attaches the pulse oximeter probe to the patient and hooks it up to the monitor, which feeds in required data into the machine and then displays the oxygen saturation. Based upon the display that is seen, the intensivist makes adjustments in the oxygen supply. Imagine what would happen if the probe was faulty, or the machine was damaged, or the intensivist was tired and he misread the display information. Any or all of these events is possible. But the advantage is we are humans. We are resilient beings. We are capable of coping with and compensating for complex and unclear designs in workplace, including faulty or improper equipment and poorly designed infrastructure. That is because we are good at making sense of our environments, finding shortcuts, solving problems, and we are flexible. Our inherent need to solve problems helps us to adapt to situations well. But stress, fatigue, illness, lack of knowledge, poor communication throws us off guard sometimes, and our brain then starts playing tricks on us. So the result is errors. Take a look at this optical illusion. Do these lines appear crooked or straight to you? To me, they look both crooked at times and straight at other times. Under suboptimal conditions, we have a hard time making sense of incoming information, which often results in poor decision making. Look at this. Have you ever heard of the Stroop effect or the Stroop test? It is a test of cognitive interference and our brain's ability to process information. So the reader is instructed to read the color of the print of each word, not the word itself. That means the first word is yellow, but I am supposed to resist saying yellow and instead say green because that is the color of the print. Many normal people have a hard time performing this task rapidly and they tend to read the word itself instead of stating the print color. That shows our brain can play tricks on us, and we often tend to make poor decisions when we are loaded. Now, misperception of situations, despite our best intentions, are an important reason that our decisions and actions can be flawed, leading to what we call silly mistakes. Now, regardless of intelligence, experience, motivation, and vigilance, people do make mistakes. The problem with errors at workplace in healthcare is that they directly affect the patients who are already vulnerable people. So now if we had to define error, we could say it is a failure of a planned action to achieve its intended goal. For example, in Shamla's case that we saw in the previous module, the healthcare team that worked on her case failed to achieve its desired goal of a successful mastectomy without any complication. Somewhere the planned action had failed. James Reason defines error as the difference between what was done and what should have been done. So, is doing the wrong thing when meaning to do the right thing. In a nutshell, error is the downside of having a brain. Hence, we say to err is human. The earlier we accept that errors are inevitable, the better we can start working on reducing their occurrence. So, what are the situations that increase the chances of us making mistakes? Unfamiliarity with the task and inexperience, especially when there is no supervision, is one of the leading causes of mistakes. Being short of time, especially among the nursing staff, when they're short of time and have a lot of work to do, there is an increased chance of making mistakes. Inadequate checking practice, poor procedures, lack of standardized procedures and protocols, and poor human equipment interface. There are some individual factors that make us prone to errors as well, some of which I've mentioned earlier. Firstly, the limited capacity of our working memory and our ability to multitask in high tension situations. It is worsened by stress, fatigue, hunger, illness, language and cultural barriers, risky attitudes. Think about it for a minute. How often do we come across resident doctors who are working 2-day calls, are exhausted, not having meals on time, and are stressed? How safe do you believe such a workforce is? Now, two factors with the greatest impact are fatigue and stress. Prolonged work and fatigue associated with it is known to result in the same cognitive impairments that occur in someone who has consumed alcohol. Think about it for a minute. This is one of the favorite stress performance plots that we psychiatrists often use, the Yerkes-Dodson curve. It depicts the plotting of human performance against stress on a graph, and the result is an inverted U-shaped curve. With low level of stress, there is boredom and reduced alertness, which results in poor performance, which you can see on the left side. And on the other extreme, with high levels of stress, there is intense arousal, intense anxiety, which again decreases performance, which you can see on the right side. And in the middle, the area which is colored gray on your screen is the part of optimum stress. It's the right amount of stress that keeps one alert, motivated, focused, and results in our best performance. A good acronym to remember at work is if you're hungry, angry, late, or tired, you must halt. So the acronym HALT tells you the time when you should take a break or seek help from a colleague or delegate responsibility so that the work in hand is done well. Another useful acronym to know whether you are safe to go to work or not is I am safe. I am safe is the acronym which stands for illness. If you're ill, don't work. Medication. If you're taking any prescription, over the counter, or other medications, let your superiors or your supervisors know because you may not be safe to work. If you're under any kind of stress, if you're under the influence of alcohol or any other substances or drugs, if you're feeling fatigued, or if you're emotionally disturbed, in any of these situations, recognize that you are not safe to work and you need to let your supervisors know and hand over responsibility to a colleague until you are better. So now let's see what are the ways that medical trainees or other healthcare professional students can put this knowledge of human factors into practice. First of all, start by applying human factors thinking into your own work environment. In the last module, I encouraged you to apply systems thinking. You need to add human factors thinking as well. Think about the person, the workplace, and the tools. Avoid relying on memory. Use cue cards, printed guidelines, carry pocket handbooks of drugs and commonly performed procedures with you. Confirm your actions against diagrams or flow charts. Memorizing everything seems to be the goal in exams, but in real life, while treating patients, it turns out to be counterproductive. And it is always prudent to avoid relying excessively on memory. Make things easily available. Put them up in your workspace if possible. You must have noted the steps of hand washing posters that are put up over wash basins across our hospital. These pictorial reminders put up in key areas are valuable aids to reduce errors. So every time you wash your hands at the basin, you will be reminded of the steps of hand washing. Use evidence-based and simplified processes. For example, use proven methods for effective patient handoffs. Read back verbal instructions, and so on. Standardize procedures and processes. It is not uncommon to observe that every department has its own way of performing the same task. For instance, in one department, it may be usual to send basic lab investigations of all patients who are admitted, while in another, it may be dependent upon the patient's history and clinical examination. Now, such situations are often a breeding ground for confusion and mistakes. Imagine you were working in one department where you were sending the lab reports for all admitted patients, and now you have moved to a new department where that is not the protocol. Instead, creating simple and uniform processes and procedures reduces the chances of mistakes. Use checklists. You can create your own checklists to help ensure work is done on time. For example, creating and routinely using a pre-operative checklist of all investigations that must be performed will ensure that you don't miss critical pre-operative workup. Decrease reliance on vigilance. It is easy to become distracted and bored, especially when you're alone and you're tired. Working in effective multidisciplinary teams can help mitigate problems arising out of being alone and tired. So, to summarize, errors are inevitable no matter how experienced and how intelligent we are. We must recognize the situations that make us prone to make mistakes and take appropriate preemptive actions. And we must utilize human factors principles so we can effectively reduce errors and their consequences. Thus, human factors engineering designs the workplace and the equipment to accommodate for human fallibility and limitations. I end this lecture by reminding you that it is important to recognize that safe healthcare delivery is about taking into account the person, the tools, and the workplace. Namaste.